they're blaming it on the age of the animal. Well, the animal's old and all cats get kidney disease. Or this, we can't link this. It can't be the Solensia because we were told Solensia doesn't have any side effects.
Every prescription medication comes with an insert that details potential risks and side effects. The problem is, most pet lovers never see that insert or are even informed of any potential risks before use. Whether you ultimately decide to use these medications, alternatives, or a combination of the two is your choice to make. The goal of this video is not to spread fear, but to educate and empower pet parents so you can ask informed questions and make the best decisions for your own pet. Hi, I'm Dr. Judy Morgan, and my guest today is Dr. Josie Bugh, who earned her veterinary degree from the University of Wisconsin in 1998. While in school, she was president of the student chapter of the American Holistic Veterinary Medical Association for 3 years, allowing her to introduce the student body to alternative healing modalities and to learn from many of the pioneers of holistic veterinary medicine. Dr. Josie did relief work for 30-plus practices in South Florida while completing advanced studies at Chi University. After receiving her acupuncture certification, she started her house call practice in 2001. Josie, welcome. Thank you for being here today.
You are welcome. Most welcome, Judy. Thank you for having me and getting the word out about this.
Yeah, so we're talking about monoclonal antibody injections for arthritis. And for dogs, we have Librela and its big set of side effects. And then for cats, we have Solensia. Frankly, I feel like people don't recognize that their cats have arthritis and mobility issues as readily as dog people do.
Yeah, I think that's a big problem with cat medicine because cats hide their diseases so well.
Yeah.
So a lot of it'll be like they'll finally notice, oh, they're not jumping up on the kitchen counters anymore, and we don't have to hide things from them, or they're not jumping up on the bed as easily. But it's not nearly as apparent as it is in dogs.
Right.
Also, cats, in terms of treating arthritis, they can't handle a lot of the nonsteroidal anti-inflammatory drugs, because their little livers don't metabolize drugs. Yeah, they don't process them the same way.
Cats are a little weird that way with a lot of drugs. Yeah. So we do have a lot less alternatives, although from a natural standpoint, we have a lot of the same alternatives, which is amazing. So I'm guessing there's first of all, a lot less cats go to the veterinarian, a lot less cats have noticeable mobility issues that the owners would be in tune to. So I'm guessing that a lot less Solensia is used than Librela for the dogs.
I don't have specific statistics on Solensia because, again, it's like the dogs get more of the attention than the cats. And I'm personally a big cat person. But I think what's happening is what I'm seeing in my cat population that I treat is cats, and this goes back to the food, cats get very addicted to the dry kibble, and it gets very more difficult to get them switched onto good food. And the longer they're on dry kibble, the more inflammatory they are. So in the past, say 10 years, I've been seeing a lot of cats that are almost crippled with arthritis when they get really old. Like their arthritis is all the way through their body with inflammation. Yeah. So I think it's a lot of those cats that are getting the injections. But then again, when Solensia came out before Librela, the drug company was really pushing these medications. Yeah. They were pushing it before they released, saying, oh, this is, it's a once a month injection. They have to come into the clinic to get it because they don't want it accidentally injected into a person. Number one. And it gets those cats into the clinic when a lot of people, it's very difficult. People don't bring their cats into the clinic.
That's true.
Yeah. So there was that whole marketing thing. And I think a lot of vets jumped on it for that as well. But cats, we're seeing the same side effects in cats as we are in dogs. And I actually had, when Solensia first came out, I had a client who wanted to use it, and I refused to inject it in the cat, and she got it from her other vet. And I warned her, one of these one day it's probably going to have a severe reaction. She's like, well, how am I going to know? And I was like, you will know.
Yeah.
You will know. And sure enough, I think the cat, I mean, I do think for this particular animal, it may have been a good choice. The cat got 12 good months. The cat was actually out climbing a tree and stuff when the cat could barely move before. But it did throw the cat into kidney failure. And then one morning she called me up and she said something really, really horrible is going on. And the cat was bleeding out, couldn't move. And I went over there as soon as I could get over there to put the cat to sleep. So I'm sure the cat was having some type of an immune mediated reaction to the drug.
So I'm seeing reports of the same things, increased thirst and urination, partial paralysis, inability to walk completely down. We see seizures, we see autoimmune reactions, we see sudden death. Of course, when you're looking at a social media site that is labeled, "Did Solensia kill my cat?" who is going to post on there? It's going to be people who had problems with their animal getting the injection. But the fact that these groups have thousands and thousands of members should be enough for us to wake up and say, oh my gosh, this many people are having problems?
Exactly. I mean, you would think, and I don't have exact numbers on Solensia, but on dogs it's up in the 18,000s. And every day I stopped going on those groups because it would just rile me up every day.
Yeah.
And I've talked to actually veterinarians. I was teaching at the acupuncture school, and I brought up these injections and they're like, oh, but we were told there was no side effects. And then what's happening is they're almost like vaccine side effects, because people will come back in with older animals and they're blaming it on the age of the animal. Well, the animal's old and all cats get kidney disease. Or this, we can't link this. It can't be the Solensia because we were told Solensia doesn't have any side effects. And so a lot of cat owners and dog owners are being almost like gaslit by their veterinarians. And I've had people even contact me later and they were like, their animal wasn't even treated for the side effects they showed up at the clinic for. It's a very weird situation that way. It's sad because cats have very delicate kidneys as it is. And we know that. And so anything that can push that over the edge.
Well, and interestingly, I've seen quite a few articles recently just talking about how vaccinations, like regular vaccinations that we give our cats, contribute to kidney disease down the line, probably from the autoimmune reactions that are occurring. And a lot of those antigen antibody complexes like to lodge themselves in the kidneys, in the little glomerulus, which is the functional unit that it's the little workhouse of the kidneys. And so if they're being clogged up with antigen antibody complexes, the first time I ever heard that talked about a lot in the veterinary field was when Lyme disease first came out. We got Lyme disease nephritis. And it was like, well, what's causing the kidney disease when they have Lyme disease? Well, it's the antigen, which is the Lyme organism, and the antibody, which is the killer that the body makes, the immune system makes, to bind to it and make it not able to do what it wants to do. And that's exactly what these injections, Solensia Librela, that's what they are. They're an antibody that is glomming on to the nerve growth factor. And then we get these huge complexes, these protein complexes, and they plop down in the kidneys. And for a kitty cat, we don't want to give them any more of those.
No, we don't. And then on top, it's not even just the kidneys, but the other parts of the immune system will see those as foreign bodies and mount an immune reaction. So when you hear monoclonal antibody, it sounds almost like a natural thing that you would give for the body, but it's not. It's a genetically engineered large protein that's created using recombinant DNA techniques to go in and specifically bind to different things in the body. So they can design it, like for COVID, they designed it to bind to the virus. For cancer drugs, they designed these monoclonal antibodies to target specific receptors on cancer cells. For Cytopoint, it binds, I forget the name of the molecule it binds to, but it's a very specific part of the immune system. Right. For Librela and Solensia, Solensia is the cat version and Librela is the dog version. They designed these genetically designed them to bind to something called nerve growth factor. So you have different parts of this. You have the monoclonal antibody, which is a foreign protein you are injecting into the body. Then you have nerve growth factor, and you're binding and making nerve growth factor biologically inactive in the body. And then when the antibody binds to nerve growth factor, you end up with very large antibody antigen complexes circulating throughout the body. Yeah. One of the bad things we're seeing in cats as well are the dermal lesions at the site of the injection, because there's a lot of nerve growth factor is not just in arthritic joints, it's in heart tissue, it's in the pituitary gland, and it helps the sensory nerves in the dermis repair and grow. And so it's doing something by binding to the nerve growth factor. It's doing something where it's actually causing like necrotic lesions in the skin. Wow. The skin is just opening up. Yeah, it's really sad when you see that.
Which, you know, so many drugs, like we have this long list of spooky drugs that we talk about. And so many of them, the side effects are these huge skin lesions, hot spots, breaking out. That is just the body saying, I want this out of here.
Yep.
I am going to spit it out. And if I have to make a big hole in my skin to get it out, that is what is going to happen. I think we need to really think twice. So for kitty cat owners who are considering getting Solensia, please, please, please ask what the side effects are. Read the drug insert. Ask questions. Don't blindly agree, wow, this is the best thing that's ever happened for cats, because it may not be. There is a half-life on these drugs where they sort of wear off, but there is no antidote. So if your cat, you know, is paralyzed, not eating, and peeing like a fiend 12 hours after getting the injection, we got nothing, right? Except supportive care.
Supportive care. And there are I've actually a couple cases that have come to me early on. I've used proteolytic enzyme therapy, because proteins are not metabolized like drugs through like the liver P450 detox systems. They're broken down by enzymes and by ribosomes intracellularly and in the blood. And I was using high doses of protease on some of my cancer cases years ago. So I do high dose protease to get into the bloodstream to hopefully dissolve and break down some of these antibodies and those protein complexes. Whether it works or not, it's hard to say. I mean, but it's something to do. It's going to detox the animal. It does have immune modulatory effects as well. So it might help modulate some of the immune responses. The other thing is lion's mane mushroom, because lion's mane mushroom does promote nerve growth factor. So if we can get some more the body producing more active nerve growth factor, that's going to help as well. So it's kind of a multi-pronged approach. And then just supportive care. I mean, if you have an animal that's peeing all over and can't stand up, or if you have an animal, I've had several dogs come to me with lockjaw, and cats where they just won't eat and they can't open their jaw to eat. Wow. So people, you know, syringe feeding, that type of supportive care, getting them off the inflammatory food. And I know you preach this all the time, but get them on a whole food diet, especially our kitty cats. Get them on meat and organ meat, you know. So that to give their body every chance it can to help heal and hopefully come out of this.
Yeah. If we can keep them alive for 30 to 40 days with supportive care.
And the half-life is actually more like 80 days.
Yeah. That's the problem, you know, for a lot of these people. And that's, you know, the same thing with any drug that you put in the body, and they say, oh, this one lasts for 1 month. This one lasts for 3 months. This one lasts for 12 months. It's not like the switch magically turns off on day 30 or day 90. These things stay in the body for a very prolonged period of time. So it's going to be a lot of supportive care. So, you know, if this is the last straw for your cat, he's not able to get up, not moving at all, immobile, and you want to give it a try, you may have one of those miracle cases where the cat gets up and runs and feels better and is able to jump and climb. but just be aware that you may also be setting yourself up for, yes, this really is the end, because we could have a bad reaction as well. These drugs wouldn't stay on the market if they didn't have benefits for enough patients to keep them on the market. But we just want people to go into making these decisions with your eyes wide open and knowing what the potential is, and maybe looking at, is there something else I haven't tried that I could try that wouldn't have the potential for these types of side effects. Josie, thank you very much for all the work you're doing on this. Thank you for being my guest. I really, really appreciate everything that you're doing.
And I wanted to mention the website too,
absolutely.
petadvocare.com. It does go for Solensia and cats as much as dogs. And on that website, I do have a whole entire recovery protocol of things people can do. So everything's listed out there on things people can try and different options for arthritis as well. So,
okay, great. Yeah. That's amazing. Thank you for setting that up. It's a lot of work.
Welcome. Yeah, it is. It is. And we have actually, there's also, there's a wonderful, and this just goes for anybody who's recently lost an animal. There's a wonderful video with a grief counselor on there on things people can do working through the grief of losing an animal. So very practical suggestions she gives as well.
Amazing.
So
amazing. Thank you so much.
Yeah, you're welcome. You're welcome. Thank you for having me and getting the word out.